Hello everyone, I'm going to present a case series on lymphoma, which is known as the Great Imitator, and the role of CT in initial diagnosis. Introduction. Lymphoma is a relatively common malignancy affecting all the ages, but it predominantly affects those in later life. Like various other conditions such as tuberculosis, lymphoma is known as the Great Imitator and should be considered when mass lesions are seen anywhere in the body. The diagnosis of lymphoma is usually suggested by widespread lymphadenopathy. Extranodal involvement is seen not only in widespread nodal disease but also in the absence of other significant lymphadenopathy. The polymorphism of their expression depending on the organ involved, their variable aggressiveness, and the relative rarity compared with the primary or secondary diseases sometimes make it very difficult to diagnose them for imaging. And CT with IV contrast material is the first investigation of choice whenever there is strong clinical suspicion of lymphoma. And also, without any clinical suspicion, CT helps in making up early provisional diagnosis. Early diagnosis is crucial for saving the life of patient, as treatment regimens available for lymphoma are a boon for the life of patient with high cure rates. Aim of this paper is to study the various forms of presentation of lymphoma, which is the imitator of different diseases clinically, and to study the role of CT in the early initial diagnosis of disease, which ultimately paves the way for early staging and treatment. So we are going to study a variety of cases and the role of different imaging modalities in this. First case that I am going to discuss is the commonest case that we see is a lymph nodal form, and that sometimes it form a conglomerated lymph nodal mass. So whenever we see a large mass anywhere in the body, we should consider lymphoma in the diagnosis. These are the images of axial images of contrast enhanced CT, and in this image we can see that multiple variable size lymph nodes are seen in the abdomen, in the para-aortic, retroaortic region, and it is encasing the vessels almost, and in the sagittal section we can see that there is upliftment of the superior mesenteric artery, but there is no luminal narrowing seen as such. In the next image we can see that is known as the sandwich or hamburger sign, and here we can see that the renal vessels are seen surrounded by a hypovascular mass, and which is causing the engagement of the vessels but not luminal narrowing. So this is a particular sign of lymphoma. So this is one of the commonest presentation of lymphoma, that there is engagement of the vessels or the structures without any narrowing. Second case that we're going to discuss is the another common presentation of lymphoma, that is gross organ enlargement. And the organs that are seen to be enlarged are the lymphoid organs, or we can say that the organs involved in the hematopoiesis. So we are going to see the enlargement of liver and spleen. Here is one of the examples, and we can see the gross enlargement of the liver and spleen. Liver is measured to be around 30 centimeter, and spleen is approximately 23 centimeter in the craniocaudal dimension. So whenever we see a gross organ enlargement, lymphoma should be a clinical suspicion. Third involvement that we are going to see now, we are going to study the external involvement. Third case that we are going to see is in the thoracic involvement. So a 17-year-old girl presented with symptoms of breathing difficulty, fever, and chest pain. So chest radiograph is advised, and on chest radiograph we can see that there is mediastinal widening, and we can clearly appreciate the trachea and the branches. So about this mass, so CT chest was advised, and on the CT chest we can see a large, relatively well-defined lobulated soft tissue attenuation lesion in the anterior mediastinum that is showing mild homogeneous enhancement. Anteriorly, the mass lesion was abutting the anterior chest wall, and posteriorly it was causing the posterior displacement of the mediastinal structures. And the mass lesion is reaching up to the lower level of thyroid on the right side, and it was causing complete encasement of the superior vena cava, right and left brachiocephalic veins, but there was no narrowing of the vessels. Also, there was partial encasement of the pulmonary trunk. and all this. Again, we can also see in the Excel image there is moderate pleural effusion on the left side, and so it was a case with massive enlargement in the anterior mediastinum, and on further investigation the lymphoma diagnosis was made. Next case that we're going to study is showing the renal involvement, and a 15-year-old girl presented with pain, abdomen, recurring fever, night sweat, loss of appetite. Clinical tuberculosis was our first suspicion, and CECT whole abdomen presented with a different picture. So on CECT images, we can see in the axial and the coronal images that there are multiple hypoenhancing, hypodense lesions are seen in the cortex of both the kidneys. So this is also like one of the presentations of lymphoma, and it was completely like unexpected case. So lymphoma can present in any form in any age group. Next case that we're going to discuss is meningeal and spine involvement, and showing the meningeal and spine involvement. A 31-year-old male presented in the neurosurgery department with the complaints of bilateral lower limb pain and backache, tingling sensation was there, fever, weight loss, loss of appetite, and the patient had MRI dorsal lumbar spine done outside, and which suggested the infective etiology and possibly tubercular, and patient was put on ATT for 5-6 months, but there was no improvement in his symptoms. And so contrast enhanced MRI was advised, and CT guided biopsy ultimately helped in the diagnosis. So on the MRI, in the T1 weighted image, we can see that on this T2 weighted image, we can see that abnormal hyperintensities are seen in the various multiple vertebral levels, and also we can see some mass in the epidural space also. And in the coronal image, this is a T1 weighted contrast enhanced image. We can see that there is a mass in the region of the thoracic spine, and is showing some enhancement. On the axial images in this is and the thoracic region, we can see on the T1 and T2 that there is some abnormal mass present here, and it's showing mild hyperintensity on the T2 weighted image, and on the contrast enhanced T1 weighted image we can see that there is homogeneous enhancement of the lesion. Also we can see that the cord is also like involved, and the epidural space is involved. And in the region of the lumbar spine, a similar mass was also seen involving the vertebral body, posterior elements, and all this. And furthermore, we can see that the hypointensities, and this was because the patient was operated outside for the suspected clinically for the suspected port spine. And since there was no improvement, so patient was referred here, and we can see that the mass is showing enhancement on the post contrast images. And for confirming the diagnosis of lymphoma, and a CT guided biopsy was done from the psoas region, and which confirmed it to be a lymphoma. So imaging helped in the diagnosis of this patient. Also the patient presented with the like headache and all this, so contrast enhanced MRI brain was advised, and we can see that and there was no lesion in the brain parenchyma, but there was mild enhancement in the leptomeninges here. So leptomeningeal enhancement is one of the presentations of the CNS lymphoma, although very rare. So lymphoma can present in various ways, and usually the meningeal involvement, it is a sign of disseminated disease. So for further workup, whole body like CT or PET CT is advised for the staging of the patient. And in this case, although there was no involvement in the thoracic region and in the abdomen, but usually the meningeal involvement, it is a sign of disseminated disease. Next case is important is an unusual presentation of lymphoma that was involving the pancreas region, and the patient had no like symptoms like that. Patient only presented with fever, weight loss, and abdominal discomfort. So a contrast enhanced CT was performed, and in these axial images we can see that uh, mass was seen in the region of head of the pancreas, and on post contrast images we can see that it is showing an homogeneous enhancement here. And similar lesion was also seen in the region of the tail of the pancreas. So for and multiple subcentimetric nodes are also seen in the mesentery and the retroperitoneum. So a CT guided biopsy was done from the region of the tail of the pancreas, which ultimately helped in the diagnosis of lymphoma. So lymphoma can present in various phases. It doesn't usually present always as a conglomerated lymph nodal mass. So extranodal lymph node involvement is also very common. And next interesting case was of digestive tract involvement. And a 21-year-old female presented with history of fever, weight loss, and abdominal pain also. So CT enterography was advised. And so a neutral contrast was given per orally and per rectal. And on contrast enhanced images further, we saw that there was involvement in the distal ileum and in the proximal ileum also. So there was asymmetrical bowel thickening and there was some loss of murostratification, but importantly there was no narrowing in the lumen of the bowel. And so on CT the diagnosis of provisional diagnosis of lymphoma was made, which on post surgery, and biopsy was confirmed to be lymphoma. So this is also like one of the commonest present, and interestingly this patient also had history of TB, but this was not a case of tuberculosis. So we have seen some interesting cases about lymphoma and how it is involving and how it can present in various ways. So coming to the discussion part, lymphoma is a malignancy arising from lymphocytes or lymphoblasts, and it can be restricted to the lymphatic system or can arise as extranodal disease. It can affect any organ and usually present with the symptoms of fever, night sweat, and weight loss. Primary extranodal lymphomas are very rare and they pose problems of differential diagnosis. Certain common signs will suggest the condition because like a frequent hypovascular appearance or discordance between the volume of the tumor and the moderate repercussions on the organ involved. So these are the usual signs that we see on imaging. So on conclusion, that imaging findings that suggest lymphoma include widespread lymphadenopathy or conglomerated lymph nodal mass or large soft tissue mass with little evidence of local destruction. Even when imaging features are non-specific, radiological assessment still plays a role in determining the site of and strategy of biopsy, as we have seen in the two cases shown here. And making the diagnosis of lymphoma often require multiple imaging modalities. And CT is CT and why are we discussing CT? Because it is commonly available as compared to MRI, easy to assess, and it helps a crucial role in early diagnosis and also in the staging and follow-up of lymphoma. Thank you.